Dr. Chokalingam, thank you so much for joining us for the Trailblazers in Health series.
It's a pleasure.
Thank you. Talk about your interest in the cardiovascular disease and also give us some insight about your research in South Asians.
Okay. I'd like to go back to my age of 5.
Aha!
Okay. I lost my father due to heart disease.
Oh my gosh.
He was only 44 and I was just 5.
Mm-hmm.
When I was 3 years old, he went to Malaysia on business. Usually when they go on business, they spend about 3 years and come back for 3 years and then go back. So in this trip when he went, before he came back, he died out of sudden heart attack. He didn't know anything about the heart attack, any symptoms. But again, we are talking about almost 60, 65 years ago. In those days, our knowledge was not that big. So I came back from school, and then here people are crying at home. I asked my sister, what's going on? She said, our father died. I said, how did he die? They say it's heart attack. So that day I decided, when I grow up, I'll find a machine to save people from dying from heart disease. As a kid, nobody to guide me. Growing up in a village, I said, it is a machine that will save, right? So I said I should find a machine, so I should go to engineering and I should learn engineering. That's what prompted me to go to engineering school. And then somewhere along the line, somebody guided me saying that you should probably do electronics, that is the upcoming field. I'm talking about 1960s. And then when I went to engineering school doing electronics, towards the 3rd or the 4th year of my engineering, I realized that I had come to the wrong path. I should have gone to medical school to save people or to understand how the heart works. Lo and behold, when I was in my final year, I was still confused. I said, why didn't I go to medical school? As serendipity would have it, God's grace. 2 years later, IIT Madras started the new program on biomedical engineering. I just walked into the professor's room. A fellow from St. Louis, Missouri came to start the program. So I told him I'm interested. He said, sure, join. No questions asked. So he asked me, what do you want to do? I said, I want to find some kind of an instrument on cardiac care. He said, sure, I've got an instrumentation specialist who has just come back from Sweden, so you work with him. Unlike today, you can't get into IIT. It was so easy. So I started working with him. So as I started learning more about physiology at that time, I also started developing this 3-dimensional vector cardiographic machine. We all know about the ECG, which is 2-dimensional.
Right.
So this 3-dimension. So worked on it, perfected it, and then tried with patients at Madras Medical College and the ICF Integral Coach Factory Hospital. So that's the beginning of my turning from engineering to medicine.
This is interesting. Allow me to ask Dr. Chokalingam, what's your age now?
Well, you guess.
I mean, you can tell me better, but is it in late 60s, early 70s?
Well, I'm 72.
You're 72, so I guess I was right there.
Yeah.
But let me ask you, you mentioned you lost your father when he was in early 40s, just about 44 years of age. Did you, while growing up all these years, you found out he passed away when you were just 5. Did you live in fear that this could, be hereditary and could happen to you as well?
No, not at all. It never bothered me because I have some beliefs. I said, if your time is up, your time is up. But having fear will kill you every day. But the death kills you only one day. So why live 100 times, 1,000 times? So as long as you live well. So Fortunately or unfortunately, looking back, the fear never came to me.
So, did you follow any particular lifestyle pattern for yourself, ensuring that it doesn't come to you? Yes, you were away from the fear, but I'm sure there would have been a different mindset for yourself.
We don't have this much knowledge what we have today in those days. So I didn't know what kind of lifestyle I should follow. But I grew up in a village. So lifestyle is you end up walking wherever you go. And even when I started going to the college, I was going by bicycle. So you spend your energy. So what we speak today, we say energy balance, whatever you consume, you should spend it out. So that you do as a matter of lifestyle. And growing up in a nuclear family, so the food is very simple. It is not high carbohydrate. It is not high fat. So you eat simple meal. So that kept me going. But the drive to find a machine was still in my mind when I was growing up. But again, as serendipity would have it, when I was studying at IIT, a friend of mine came from Canada after his postdoctoral work. And he said, why don't you go to Canada and do your PhD? So I came to Canada in the mid-70s to do my PhD. But the school that offered me the program did not have a program in biomedical engineering. So I was enrolled in the second master's in the engineering school. But I kept on insisting everybody that I need to do something in biomedical engineering.
Interesting. Dr. Chokalingam, given your lifelong experience in the area of heart disease, what is your take on why amongst the South Asians, the heart disease is not optimally managed or controlled?
Half the problem is we are not aware. And we as South Asians, it could be part of our trait or part of our way of life, we take health as a last concern. All of us are looking at how can I progress, how can I make money, how can I do something or excel in my field, but at the risk of taking care of our health. So by the time we come to realize whether we have got high blood pressure or higher cholesterol or even the level of glucose levels in our body, we realize very late in life. Only when you get a heart attack, you think, I don't know what my blood pressure is. So this happened then, this is happening now. It's quite alarming. But we have all the knowledge today. But we should be able to do much better.
Make me understand that, how different the heart disease in South Asians who immigrate to this part of the world versus the natives, folks who live in India and the ones who migrate over here, how does the heart disease pattern work in them?
I will have to give you two time scenarios. Until 1970, the living condition in India was poorer. So people are walking, people are eating proper food, or at least on time. Whereas when people like us who come to North America till the 1970s or end of 70s, our focus is to progress well and then achieve what we came for. So, including myself, food was the last thing that I'll worry. I'll be working in my lab towards my PhD in medicine till 3 in the night, and then go home, and then eat something, and then go to bed, and again at 7 o'clock, come to work, come to studies. So, food is the last thing. I did not take it in time, and that's happening now too. See, yesterday we had a beautiful gala here. Tell me what time we all had dinner. 10 o'clock. Till 10 we don't eat. After 10 we eat and then just go straight to bed. We don't burn that energy. So the food and then the health is the last thing that we worry about. And that was the scenario. But today, in India, the numbers are quite high. Heart disease higher. Why? After 70s, mid 80s, India has become globalized. So the pent-up demand, whatever the Indians did not have, they are trying to aspire and to have a life similar to the American life.
Right.
So in the process, we sacrifice walking, we sacrifice doing exercise, and we eat, we sit down, we quietly put on weight in our stomach. So we have got central obesity, which is a major risk factor for most Indians.
I think it's a great insight from you that keeping in ensuring that we eat in time and what we are eating, that's very significant. As we wrap up this conversation, I'd like to get the reaction from you. Conferences like this particular one, organized by SKN Foundation, how helpful they are and the pivotal role they can play to create awareness about cardiovascular disease and how they can develop an alliance with the South Asian organizations. Along with that, I'd also like to get your closing remarks.
Okay. What SKN Foundation has done is phenomenal to bring the public awareness. And when I say public, these are all mostly educated people living in New Jersey. They're all working with IT industries or in well-paying jobs. But again, not realizing what is at stake for them if they don't take care of their health. And these conferences in the last 2 days, they created some awareness. And in fact, we have tons of literature, tons of work done in the past by many of us. And that is now being collated and presented. The juice of our work, the last 50 years of my work, and people like my colleagues who have been part of the trailblazers, they have done lifelong work. So these things have been condensed and put it in simple language so that people can immediately follow and make a better life for them. And my lifelong dream of no child should lose his or her father, for that matter her mother, when they were children. So this is a phenomenal work SKN is doing. And one last word is, you are what you are by what you eat, when you eat, and how you eat.
Awesome. Awesome. Great words. You are what you eat, when you eat, and how you eat.
How you eat.
Wonderful. Dr. Chockalingam, thank you so much for your time, insight, and the advice. Great knowledge. Thank you for sharing that with us.
It is an absolute pleasure to be here. Thank you.